Mr. President, as chairman of the Senate Committee on Veterans Affairs, I wanted to just take a few minutes to update members of the Senate as to where we are on some very, very important issues that impact veterans all over this country. First point that I want to make is, I think, some good news. The committee had a hearing yesterday to hear testimony regarding the confirmation of Robert McDonald to be new Secretary of the VA. And I think I can speak for the whole committee in saying that we were very impressed by what we heard from Mr. McDonald, both in terms of his passion for the needs of veterans and also his administrative knowledge, his management skills as the former head of one of the large corporations in America. I think he left us with a very strong impression. The result was that today, a few hours ago, by a unanimous vote, the Senate committee voted to confirm Robert McDonald as our new Secretary of the VA, and I hope very much that his nomination will get to the floor as soon as possible. So I think that's good news because the VA needs stable leadership. Sloan Gibson, in my view, who has been acting secretary, is doing an excellent job. He's already accomplished a lot, but it's important that we have a new permanent secretary on board. And I hope that the members here see fit to confirm him as soon as we possibly can. Mr. President, on an additional issue, I think as all members of the Senate know, about a month ago or so, we voted by a vote of 93-3, almost unanimously, to make sure that the veterans of our country get quality health care in a timely manner, that we bring a new level of accountability to the VA. And I'm very proud of the support that legislation, which was introduced by me and Senator John McCain, received. And I want to thank again Senator McCain for his very strong efforts to make that happen and for his continued support of the veterans community. Senator McCain made a statement just the other day, I think it was yesterday, published in CQ, which I personally could not agree with more. And this is what he said. He said, in terms of the conference committee that we are in right now, trying to merge the Senate bill and the House bill and come up with something that can pass in both bodies, he said, and I quote, "We've got to sit down and get this done because we cannot go out for recess in August without having acted on this bill," end of quote. And I think he's exactly right. And let me just, picking up on that theme, just relate to my colleagues what the VFW is having their annual convention in St. Louis, and this is what they said, and I quote, "The Veterans of Foreign Wars of the United States is demanding that Congress immediately pass a compromise bill to help fix the Department of Veterans Affairs before they adjourn for 5 weeks at the end of the month. Quote, pass a bill or don't come back from recess," end quote, said VFW National Commander William A. Thien of Georgetown, Indiana. Quote, "America's veterans are tired of waiting on secret waiting lists at the VA and on their elected officials to do their jobs," end of quote. And I could not agree with the VFW more on that issue. There was a bill a month ago passed here. The CBO said that that bill would cost $35 billion, and we voted for that for emergency funding because the members here understood that taking care of veterans is a cost of war as much as spending money on tanks and guns and missiles. $35 billion emergency funding. The House passed its bill, which was later assessed by the CBO at $44 billion. But here's the good news, and without divulging the kinds of negotiations that we are having with Chairman Miller in the House, and Chairman Miller is a serious man. I think he wants to get a bill passed, and I don't want to go into all the details here. But I think it is fair to say that the cost of that bill will be significantly less than what the CBO originally estimated. Now, just a A few minutes ago, Mr. President, I received and others received a letter from the major veterans organizations on an issue of important consequence. And again, without going into great detail about the nature of the negotiations that the House and Senate are having on the Veterans Bill, I think it's fair to say that one of the stumbling blocks is that I agree, and the House agrees, that it is imperative that we pass funding to make sure that veterans who are on long waiting lines right now get the quality care that they need now. And that means that if the VA cannot accommodate them in a timely manner, that they will go out to private doctors, community health centers, or whatever, and the VA will pay that bill. That is what we've got to do, because it is unacceptable that veterans remain on long waiting periods, and not get health care. There is a general agreement on that. Debate about how much we should be, that's going to cost over a 2-year period, but I think we can reach some resolution on that. Here's where the difference of opinion lies. And I'm not divulging anything, because this has been in the newspapers. Sloan Gibson, the acting secretary, came forth before the Senate Veterans Committee last week, and he made it very clear that while we have got to deal with the emergency of long waiting periods and get people the contracted care that they need simultaneously, we must make sure that the VA has the doctors, the nurses, the medical personnel, the IT, and the space they need in order to deal with this crisis, so that 2 years from now, we're not back in the same position that we are. And he came forward with a proposal, in fact, that cost $17.6 billion. I think we can lower that amount of money, because some of that request is not going to be spent this year or even next year. But the issue here is that we have got to strengthen the VA, their capacity, so that veterans do not remain on long waiting periods, and that we can get them the quality and timely care they need. Now, what I wanted to mention, Mr. President, is just an hour or so ago, I received, and Chairman Miller, who's chairman of the House Committee on Veterans Affairs, he got the letter. Richard Burr, who is the ranking member on the Senate Committee, Mike Michaud, the ranking member on the House, we received a letter from a variety of veterans organizations, virtually every major veterans organization. So this is who they are. They are the Disabled American Veterans. They are the Veterans of Foreign Wars, the VFW. They are the Paralyzed Veterans of America, the Vietnam Veterans of America, the Iraq and Afghanistan Veterans of America, the Military Officers Association of America, the U.S. Coast Guard Chief Petty Officers Association, and many other organizations, many other organizations. And I want to take a moment to read what they said, because this is terribly, terribly important. What they are saying, in essence, is yes, we need emergency funding to make sure that veterans tomorrow get the health care they need from the private sector or any place else, but we also need to strengthen the VA so that over the years they can provide the quality and timely care that veterans are entitled to. And I'm going to read this letter because it's important that members of the Senate and the House understand where the major veterans organizations are coming from. And I quote, "Last week, Acting Secretary Sloan Gibson appeared before the Senate Veterans Affairs Committee to discuss the progress made by the Department of Veterans Affairs over the past 2 months to address the health care access crisis for thousands of veterans. Secretary Gibson testified that after re-examining VA's resource needs in light of the revelations about secret waiting lists and hidden demand, VA required supplemental resources totaling $17.6 billion for the remainder of this fiscal year through the end of fiscal year 2017. As the leaders of organizations representing millions of veterans, we agree with Secretary Gibson that there is a need to provide VA with additional resources now to ensure that veterans can access the health care they have earned either from VA providers or through non-VA purchased care. We urge Congress to expeditiously approve supplemental funding that fully addresses the critical needs outlined by Secretary Gibson either prior to or at the same time as any compromise legislation that may be reported out of the House-Senate Conference Committee. Whether it costs $17 billion or $50 billion over the next 3 years, Congress has a sacred obligation to provide VA with the funds it requires to meet both immediate needs through non-VA care and future needs by expanding VA's internal capacity. And I continue. Again, this is a letter from almost every major veterans organization. And I continue. Last month, we wrote to you, they wrote to the chairman of the House and the Senate Veterans Committee, we wrote to you to outline the principles and priorities essential to addressing the access crisis, a copy of which is attached. The first priority, and I quote, must be to ensure that all veterans currently waiting for treatment must be provided access to timely, convenient health care as quickly as medically indicated. Second, end of quote. Second, when VA is unable to provide that care directly, quote, VA must be involved in the timely coordination of and fully responsible for prompt payment for all authorized non-VA care. Third, Congress must provide supplemental funding for this year and additional funding for next year to pay for the temporary expansion of non-VA purchased care. Finally, whatever actions VA or Congress takes to address the current access crisis must also, quote, protect, preserve, and strengthen the VA healthcare system so that it remains capable of providing a full continuum of high-quality, timely health care to all enrolled veterans. And Mr. President, without objection, I would like to submit this letter for the record.
Without objection.
Essentially, what the letter goes on to talk about is that many of these organizations have been looking at this issue for years, and in their independent budget have noted that the VA needs more space because you have many hospitals where there are not enough examination rooms, and that slows down the ability of doctors and nurses to treat patients, that we need more doctors and nurses. So for many of these organizations, this is not new news. They've known it for years. So, Mr. President, here's where we're at. Good news is that I think we can bring forth a bill which deals with emergency contracted out care for veterans today on long waiting periods. I think we can deal with the issue that Senator McCain feels very strongly about, and that is making sure that veterans who live 40 miles or more away from a VA facility will be able to go to the private physician of their choice. And I think we can also strengthen the VA in terms of doctors and nurses and information technology and space so that we don't keep running into this problem year after year. It is going to take the VA time in order to bring in the doctors and nurses and do the construction. So, Mr. President, I would hope, I don't want to get into the details of the discussions that we're having with the House, but I did want to make veterans and, in fact, members of Congress aware of where I believe that we are at this moment. And with that, Mr. President, I would